I get you to put up my slides, and then we'll talk about the slides. So I wanted to welcome everybody to today's presentation. We're going to do a very brief presentation about the what is COVID, because I've actually heard that some people still don't believe that COVID is actually a real thing. And so I will point out, show you what's actually happening in the world and how it's impacting the whole world and us here in BC. And then we'll talk about what kind of things to expect from COVID itself, and then some solutions. I really, really want to thank our 4 MLAs for putting this presentation together and giving us the opportunity to share our ideas and concepts, and also to actually bring forward the message that's very, very clear to all of us, is like we all need to get vaccinated to get moving forward. And the key thing that we can all do to get vaccinated is first get registered. If you are registered, make sure all of your friends and family are registered, and then look further afield. Go to your neighbors, make sure that they know that they can register, because I still run across people that aren't registered right now. And you know, we're encouraging them to make sure that they are able to put their name in to reserve their vaccine. And that's a key thing, and we need to get going. And I think our MLAs will have some surprises and good news to give us. Some big announcements that came out this yesterday and this morning about the vaccines, and we'll be able to share some excellent news with you. Next slide.
Sorry, give me one moment. There we go.
Thank you. So the pandemic has been caused by a virus that we have named as COVID-19. The other scientific name is SARS-CoV, but it's basically just a type of coronavirus which has come in from the wild and infected human beings. The common cold is also a coronavirus, a type of coronavirus. We accidentally, I think some of our world leaders were using the excuse that it's just a coronavirus, it's a type of flu, don't worry about it, it's going to fizzle out and be gone. Unfortunately, this coronavirus is quite virulent, it's quite dangerous, and can spread quite far and wide. It's spread through the air, it's airborne, and through droplets. It definitely causes respiratory infections, and the more dangerous thing is that it causes organ inflammation. And organ inflammation can end up causing heart failure, it can cause muscle aches, it can cause long-term fatigue. I was just reading a study yesterday that we're going to see a large increase in the diabetes pandemic as a result of this infection, this pandemic. There's apparently a 40% increased risk of diabetes after being infected by COVID. So again, you know, those kind of things really impact us in the long term. Short term, we're seeing about a 2% death rate, and I'll show you some numbers that are eye-popping. And 30% of patients that get infected with COVID-19 end up having long-term symptoms, and we call them the long haulers. And definitely this virus has infected the whole world. Next, please. So around the world, we've seen a total of around 155 million cases, and these are just the documented ones. There are so many more cases that are actually, unfortunately, not getting documented because people have decided to stay home and not get tested. And this often in poorer countries around the world, people may not be able to afford getting tested. We have a great publicly funded healthcare system here. We don't have to worry about being charged for testing or for the vaccine. That's just part of what our government provides for us. We have seen, as I mentioned, there was a 2% death rate around the world, and so we're seeing 3,241,462 deaths, very, very sad number to be reporting, but that shows you the extent of how severe this infection can be. And now a little bit of light at the end in there as well. And around the world, 1.2 billion doses of various different COVID-19 vaccines have been given. So 15.3% of the world's population has been vaccinated so far as of yesterday. Most of those doses are in developed countries. Unfortunately, the vaccine has not penetrated that well into developing countries. As an example, in India, there's less than 2% of the population is vaccinated, and we've seen the result of what can happen when the government did not take the opportunity to vaccinate their population. In Canada, we've seen a total of 1.25 million cases, and we've had 24,396 deaths in Canada. And we have now in Canada given 14.3 million doses of the vaccine. So approximately 34.5% of the population is vaccinated, and those numbers are true as of Monday. Next slide, please. And here in BC, about 3 weeks ago, we were seeing roughly averaging 1,000 COVID cases per day. And now, after Dr. Henry and Minister Dix implemented the tighter restrictions on movement and gathering, we've now managed to actually bring it down slightly, and we're now seeing an average of around 650 patients being positive per day. Today's count is under 572, I think is how many we were announcing today. As of today, there are 481 people in hospital, of which 161 are in ICU. Because of the overwhelming number of people showing up in hospital and having to be attended to in the ICU, we've had to cancel 1,750 surgeries and postpone them, and we'll make our way around to rebooking those patients and then getting them their treatment that they need. Since the start of the pandemic, we have had 1,597 deaths and a total of 132,353 cases here in BC. We have done a reasonably good job of getting our vaccines out, and we made a decision to focus on first doses of vaccine. We've now given 1.85 million first doses of the vaccine, which is approximately 43% of the population. There's a lot more vaccine, as the MLAs have pointed out, there's a lot more vaccine showing up on our door. In the next coming 8 weeks, we're going to be seeing anywhere from 300 to 400,000 doses of vaccine each week. And that means that we're going to probably be able to hit a target of around 70% by the end of June, quite easily. And if everybody else, anybody that wants a vaccine will be able to get a vaccine by the end of June, first dose, and then we'll focus on the second doses as well. Our clinically vulnerable folks, the people that have pre-existing conditions, 70% of them have been vaccinated with the first dose as of the start of this week. Next slide. The chance of catching a COVID infection in BC as of April 22 was 1 in 4,700. So that's your everyday chance. Every day that you wake up and you venture out of your house, your risk of getting COVID is 1 in 4,700. So that's, just leave that number there and remember that, because we're going to come back and show you some other risk numbers of what we're dealing with. And the other numbers on the screen that you're looking at show you that the highest risk of death is in older folks. So we had 68.3% of people, or 68.3% of percent risk of death in folks over the age of 85. 80% of the deaths in Canada have occurred in folks that are over 65. So the younger you are, the less likely you are to die, but the more likely you are to transmit the virus throughout your community. So we have to balance this out. Now, we have to protect the seniors, but at the same time, we've also got to help the young folk from spreading the virus. And the reason that they may be spreading the virus is conditions that they work in, the congregate living that they're in, and it's not necessarily all about partying and wrongful behavior. Sometimes you're kind of stuck working in those jobs and the kind of conditions that you live in. Next, please. So the best ways to deal with COVID-19 and make sure that we're all safe, obviously wear a mask in public. Anytime that you leave your house and you're away from your loved ones, wear a mask, make sure that you stay 6 feet away from other people that are not in your immediate household bubble. Try to avoid crowds and especially poorly ventilated spaces. So as Dr. Henry has often told us, larger spaces, fewer faces is a great mantra to kind of have in your head. And frequent hand washing before you touch your face. We roughly touch our face approximately, I think it's about 17 times per minute. And I'm watching some of the folks on the screen and they're all scratching away and touching their eyes. So be careful. You need to be washing your hands before you do that. And then the other big thing that we can all do is get vaccinated. And next slide, please. So we in Canada currently, we have 4 vaccines that have been approved for use, and I'll go through all 4 of them briefly, and then we'll go into detail on further slides. So the first 2 types, there are 2 types of vaccine. One is the mRNA vaccines. These are newer technology that we haven't used in vaccines, but we've been using it for cancer treatments. We've been using it for other inflammatory conditions. And because this particular virus was causing a lot of inflammation, this technology has been quite helpful in coming in and showing us, yeah, we can deliver this quite well. So the two brands that are out there are the companies that make them are Pfizer and Moderna, and both of them require 2 doses. These vaccines are available at our mass vaccination clinics. We can't distribute them through the pharmacies or through family physician offices in an easy way, simply because of how they have to be stored, and they have to be stored at very, very low freezer temperatures. The other 2 vaccines that have been approved by Health Canada for use here are the AstraZeneca vaccine and Johnson & Johnson. These are called vector vaccines because they use an inactivated virus vector to deliver the viral code so that our immune systems can learn what to fight against and build some antibodies. The mRNA vaccines, they provide a small mRNA protein to deliver that message. And once that message is read and the antibody production is started, the mRNA protein is destroyed and eliminated from your body in about 8 hours. So it doesn't stick around for too long. The AstraZeneca vaccine requires 2 doses, similar to the Pfizer Moderna vaccines. Johnson & Johnson so far only requires 1 dose. There is some research being done on whether or not we need to have a second dose to give it some longer impact. The Pfizer, Moderna, and AstraZeneca vaccines are available right now. Pfizer and Moderna are available to everybody over the age of 18. AstraZeneca is available to everybody, there's a mistake on that slide. It should be anyone born in 1991 or earlier, so it's 30 years and older. And that was just changed recently. Johnson & Johnson, even though it's been approved and some supplies have been delivered, has not been delivered to BC to be used right now. Next slide. So all of the vaccines actually cause soreness at the site of the injection, and that soreness can sometimes stay for a couple of hours. It could go up for about 48 hours, and the majority of folks will, about 80%, will complain of some general muscle aches and pains, fatigue, and a smaller proportion will also complain of fever and congestion after vaccination. And again, it lasts for anywhere from a few hours up to 48 hours. And you can control this with some Townhall, and it clears up and goes away. When I received my first and second dose of vaccine, I was actually, first time I was in bed for about 24 hours and then felt like $1 million afterwards. And the second time, the stiffness and soreness lasted for about 36 hours. My kids tell me it's because I'm a wimp, you will feel some stiffness and soreness. Now, the 2 more serious things that we have to talk about with the vaccines, with the mRNA vaccines, there is a rare allergic reaction to one of the components in it. It's called polyethylene glycol. Polyethylene glycol is a very common chemical that's found in multiple food sources that we use. It's found in makeup, it's found in some laxatives, processed foods is found, and if you've had a reaction to using those products, you will have a reaction to the mRNA vaccines as well. If you haven't, it should be safe. The other rare condition is also called the blood clots that are caused by AstraZeneca, and that's called VITT, vaccine-induced thrombocytopenia. We'll just leave it at blood clots, and it's blood clots specifically in the brain, and we'll talk about that on future slides. Next slide, please. So the AstraZeneca vaccine, its brand name is called Covishield. It's probably the most used vaccine around the world. It's produced in Europe, in England, in Belgium, in India, in Australia, and in the US. There's multiple different factories all over everywhere. It was developed in Oxford, England. That's where all the research was done. That's where all the production, the process was developed and then licensed out to these other large manufacturers. There's been close to about 350 million doses of Covishield given worldwide, and we've had about 280 reactions that are fairly severe, and we're going to talk about those. In BC, it's available for folks for vaccination, anyone born in 1991 or earlier, so that's folks that are 30 and older. AstraZeneca vaccine is predominantly the vaccine that was used in the UK, Singapore, and Australia. And they're using it for anybody, initially they were using it for everybody over 18, now they've restricted it also to everybody over 30. In the UK, they gave 22 million doses. In Canada, we've given 1.8 million doses. And the experience in the UK was that after they gave the 22 million doses of AstraZeneca, their infection rates plummeted. It dropped by about 80 to 85%, which is amazing. Really, really effective vaccine. All four of the vaccines that we've talked about have had incredible real-world results. So often that we hear in the news and in the media about numbers about efficacy, and this one is 66% efficacy, this one at 80% efficacy. In the real world, a lot of that doesn't matter, simply because the efficacy numbers are lab data numbers. And each time that you do a study, you have different populations that participate in the trials, different ways of measuring the data, and it can give you different numbers. What we need to really focus on is the real world data. And the real world data, classic place to get that data would be the UK, would be Scotland, would be Israel. And what we've seen where they've used these, all four of these vaccines in comparison, we're seeing that anybody that got vaccinated with either of these four products, 100% reduction in the risk of death. Perfect, that's what we want. When we give a vaccine, we want to know that once you receive the vaccine, that you're not going to die of the infection. We're also seeing 95% reduction in the risk of severe illness or hospitalization. That's across the board, not much difference in the effectiveness there. And we're also seeing 90% reduction in transmission after 2 doses. The AstraZeneca vaccine in England was showing an 80% reduction in transmission after the 1 dose, right? So dramatic impacts on how restrictive we have to be after the vaccines. Next slide, please. So the rare side effect that has everybody scared about the AstraZeneca Covishield vaccine is a blood clot that occurs in the brain, and it's called vaccine-induced thrombocytopenia, or the other name that you may read about is called cerebral venous sinus thrombosis. Basically, it's just a very, very small blood clot that occurs in the brain, and it occurs because your body's, the antibodies that your immune system is producing creates these antibodies that go out and fight your platelet cells and decreases the platelet number, which then increases your bone marrow to produce more platelets. When you get an excessive amount of platelets being produced, they tend to stick and create blood clots. When those blood clots float up into the brain, you end up getting these symptoms. The chance of VITT across the world in the data has varied in different age groups, but the range that we're seeing is anywhere from 4 to 11 in a million. And this is based on real world data. In Canada, we've given 1.8 million doses of AstraZeneca. We've had 7 cases to date. And unfortunately, we've had 2 of those folks pass away. So it does show you that the data is pretty accurate in that the risk of occurrence can be anywhere from 1 in 100,000 to 1 in 250 to 300,000. It seems to be more common in younger people that have more inflammatory reactions to foreign agents, and but it can also be seen in a range for anywhere from 18 to 93. The average seems to be around 47. Slightly more likely to be seen occurring in women, and that the data seems to suggest that's only because of the numbers game. More women have been vaccinated across the world so far because they're the ones that are providing the healthcare, right? So there's more nurses, more female doctors, and so therefore they are the ones that are going to get vaccinated first. And in all of the data that I've been able to find, it's often this is only happening with the first dose, and only 1 case showed that it was in the second dose. Next slide. So comparative risk. So when we often look at risk, we need to look at absolute risk, relative risk, and comparative risk. Absolute risk means how much risk do you have with that one individual thing. Comparative risk is where we compare with other things that may happen to us. And in this situation, that's actually a very, very important thing for us, right? So we can see if you're saying, okay, the risk of taking this vaccine is that you may 1 in 100,000 chance of you having a blood clot happen. Well, what does that mean in real terms? Right? To me as an individual, if I was that one person in 100,000 that was going to get it, that would be devastating. And I get that. But what's the risk of other things happening? As I mentioned earlier, I had told you that the risk of catching COVID every day as soon as we leave the house is 1 in 4,700. That's a much bigger risk than getting a small blood clot in the brain. Other risks in comparison, so in a 25-year-old, the risk of having one of these blood clots is 11 in a million. In a 55-year-old, is 4 in a million. The risk of dying from coronavirus is 23 in a million. So again, it's much higher, right? The risk of a 55-year-old dying from coronavirus is 800 in a million. As those numbers go up, that means you've got a much higher risk. Every day when we get up and we leave our homes to go to work and we go outside, you actually have a risk of dying. So you have in a 25-year-old, the risk of having an accident or injury is 110 in a million. A 55-year-old is 180 in a million. Your risk of dying in a road accident is 38 in a million if you're younger, and a little bit lower in if you're older. If you're the risk of being hit by lightning is 1 in a million. So that kind of shows you the relative comparative risks. So, you know, the risk of getting these blood clots is very, very low. It's there. And each person has to be comfortable with that risk that they're taking. But this is informed consent that's required, and understanding that's required. But if you feel comfortable getting up out of bed and leaving, going to work, and not worrying about dying in a car accident, that's going to be a 38 in a million chance. I don't think you need to be worried too much about a blood clot occurring in 4 in a million. All right, next slide. So again, we're going to, if you're not vaccinated and you catch COVID, the risk of developing blood clots is 1 in 100. Or 10,000 in a million. So again, more risk for blood clots is actually occurring with the COVID infection. And this is, again, because of the inflammatory conditions that COVID causes. If you end up being so severe that you have to go to hospital, your risk of getting a blood clot in hospital because of the COVID infection is 1 in 5, or 200,000 in a million. That's a much, much higher risk. So I think in areas where there's a higher risk for infection, it makes sense to get the first vaccine that's offered to you. With respect to the blood clots that are not related to vaccines, younger women, typically just being a younger woman and the hormones involved, you have a 1 in 3,300 chance of developing blood clots. And if you happen to be using a birth control pill, it's 1 in 1,600. If you end up getting pregnant, it's 1 in 300. Much higher risk, and often we don't even think about those, right? So again, this is where comparative risk is important to understand. According to Stats Canada, COVID-19 related deaths in 2020 exceeded all other leading causes of death except for cancer and heart disease. Next slide. Letitia, next slide, please. So yeah, that's one. Thank you. Yeah. So the advice from Health Canada and even from NACI is always has been, and it's been the same, is that the benefits of the vaccines far outweigh the risks in the majority of people, and your risk of being infected with COVID-19, being hospitalized and dying, far outweighs your risk of the rare VITTs. So the recommendation is please get your shot, accept whichever Canadian approved vaccine is offered first, focus on the rest of your health, and let's get life back to normal. Next slide. So, and then the big important step that we have to remember, and this is the biggest message that I want to deliver today is go on to the website at getvaccinated.gov.bc.ca and register yourself. And depending on your age cohort, you will get a booking code. As of tomorrow, they will be booking 50-plus-year-olds, and then just get vaccinated and let's get life back to normal. Thank you.
Thank you so much, Dr. Sanghera, for this presentation. Certainly, you have proved the science behind how devastating COVID could be affecting our health, as well as evidence-based data on why it's important to get vaccinated. As my colleagues have mentioned, we're expecting to get over, we have expected are getting over 1 million doses of Pfizer in May. And that special exciting news that you were talking about. This morning I heard on the radio that Health Canada announced that fiber can be now administered to persons age of 12 or older. So our adolescents can now also be able to get administered Pfizer as well. So at this time, every time there's a break, all of us are going to be encouraging everyone who is over the age of 18 over to register for their vaccines today. And we're going to have the website and the number in the chat. So please feel free to write that down and share it on your social media, share it with your friends. Book your appointment today as soon as it's your turn. And I think 18 plus can all be booking now. As Dr. Sanghera has said, all the vaccines are safe and very effective. And every person vaccinated makes us all safer and get closer to putting COVID-19 pandemic behind us. So at this time, Dr. Sanghera, I have been talking with my constituents and just gathered a few things, maybe around a thematic area for AstraZeneca. So would like to just probe a little bit and help my constituents ask these questions. So there'll be three questions in total. The first one is, so it's on the blood clot that you were just talking about. There is concern about AstraZeneca and blood clots. I know you just revealed the science and the risks of it. So how can it be prevented? So if one thinks they might be more of a high risk to blood clot, can it be prevented, or is there an alternative treatment to that?
So there are a few people that should not be getting the vector vaccines. The vector vaccines, both the AstraZeneca and the Johnson & Johnson vaccine, they have been linked to this rare blood clot condition. And so the folks that have a blood clotting problem, such as where there's one of the factors in your blood called factor 4, if that is causing you to have small blood clots naturally, and you are on, and you may not know that you actually have that condition, those folks need to go and get a blood test done. And if you've got a low platelet count, maybe those folks should be recommended to go get the mRNA vaccine, the Pfizer or the Moderna. And that's the only case that I've seen so far. Now, I know that initially there had been another question submitted about is it on the blood clot only with AstraZeneca, or is it with the other vaccines too? It's more common with the AstraZeneca and the Johnson & Johnson. The range is anywhere from 2 to 4 in a million. With the Moderna and with Pfizer, it's 1 in a million. So it's pretty rare, but it's still there. We see anywhere from 1 to 2 in a million is a natural occurrence in all of us anyway, even without vaccination.
Thank you, Dr. Sanghera. The second question is, sorry, go ahead.
Sure, I was just going to add, so if somebody receives the vaccine and they are experiencing any kind of symptoms consistent with headaches, blurry vision, dizziness, I would recommend that they talk to their family doctor, and we can easily identify this condition. It's just one simple blood test, and then we can treat it. And that's why in Canada and across the world, we've been able to prevent the serious deaths that have been a risk. So before we knew what this condition was and the likelihood of it occurring, it sounded much more risky. Now that we know what we're looking for, we can actually treat it as it occurs and have good outcomes.
Thank you so much, Dr. Sanghera, and that information is really helpful, and it also helps relieve some of the anxiety with AstraZeneca. The second question is, with all 3, AstraZeneca, Pfizer, and Moderna, and so wondering, when one gets a shot, what's the expectations of the number of days and how much protection one person would get after these shots, and in comparison to getting the second dose?
Okay, so all of the first shot ones have been showing about 80% protection after 4 weeks post first injection. So a lot of people unfortunately think that as soon as they get the vaccine, the needle's in, they've got some antibodies building, they've got some protection right away, and they let their guard down. And in the following week or 2, unfortunately, they get exposed and then they catch COVID. Right, and then the antibodies don't build up enough to give you protection until about 3 weeks, and so it's better to wait at least 4 weeks so that you get the 80% protection beyond the first injection. After the second injection, that protection can go up to about 92 to 95%.
Thank you so much, Dr. Sanghera. So it does give quite a bit of reassurance to everyone. Please get your shots, and when you do get your shots, please continue to practice safety measures. Continue it on unless everyone has their 2 shots. The last question that I have is more of a hypothetical question. My constituent was wondering, so many of us are getting our shots the first chance that we can, but there are those who are still worried and is holding off getting the shots. Now, you did mention that the shots would be 80% effective even after 4 weeks. Mm-hmm. So wouldn't that affect those who do not have shots? How much would it affect those who already have their shots? Wouldn't the vaccinated still suffer? That was a question from my constituent.
Yeah, so if we don't get enough people vaccinated, even the people that are vaccinated, these vaccines are not 100% effective. The best that we can hope for after 2 injections is 95% protection, right? So you've still got a 5% risk of getting infected and getting sick. If there's a whole bunch of folks out there that are not getting vaccinated, they could be carriers and they're continuing to spread the virus. That means that we're never, ever going to be able to lift all of the restrictions that this pandemic has put on us. And so then we'll continue as is, right? And there may have to be some sort of separation of the vaccinated and the unvaccinated. And some discussions around the world have already started about vaccine passports for people that are traveling. Europe has already said that they will be requiring either vaccine, proof of vaccine, or a strict quarantine. And there's discussions in the world bodies to indicate that that's going to be a similar thing for most countries. And they're starting to do tests on how people that are, how protected are people that are vaccinated if they were to congregate together at a concert. They had a large concert to test things out in the UK this last weekend, and they also had another one in Spain. And so those kind of tests are happening, and we're going to start to learn more about how we can interact with each other. But if we don't get to that 80% mark with the percentage of people that are vaccinated, then we're all going to continue to be at risk, and we're all going to continue to have to do some level of restrictions on movement.
Thank you, Dr. Sanghera. So what this really means is every person vaccinated makes us all safer and gets us one step closer into putting COVID-19 pandemic behind us. But what the pandemic has taught us as well, as Dr. Sanghera had mentioned, all the precautions that we need to take to keep ourselves healthy, not only free of COVID-19, but of all viruses around us, is reduce the opportunities of touching your face, perhaps continue to wear a mask, but always wash your hands or sanitize your hands. I understand my colleague Katrina Chen also has some questions for you.
Sure.
Yes, totally. Thank you so much, Dr. Sanghera. I feel like I personally learned a lot from your presentation and answered a lot of my own questions too. So I do have some other questions from our constituents. The first one, I think you kind of touched on it, but if you don't mind elaborating, is how do we know that the 4 months time window between the first and the second dose is safe? Because on the website, for example, for Pfizer and Moderna, they do recommend it to do the second dose in 2 weeks after the first dose. There are just, I think, some reassurance around that of what we're doing here in BC.
Right, sure. And that's actually a really good question, because that initially, when I first saw the Moderna and Pfizer websites and the AstraZeneca websites, you started to look at the details and say, well, what were they looking for and what were they trying to do? So when they ran their initial studies and trials, they were looking for, when we give the first dose, we get a certain amount of protection. And I said at 4 weeks, we get about 80%. So when they did their trials, that they found that at 3 weeks, they were around 66%. And that's the efficacy numbers that you hear about, right? And that 66% is okay, but it's not great. So at that point, they said, well, what time period do we have to do in order to give it a boost again, right? And remember, we're trying to quickly get a product out to protect everybody. So they couldn't run studies for 2 to 3 years to really know everything. So they wanted to know, if we give the 2 shots too close together, does that actually help us or not? And what they found was, if you gave the 2 shots less than 2 weeks to get apart, then there was no extra benefit. The body considered those 2 shots to be just 1, right? So you didn't increase your antibody count further. With the AstraZeneca vaccine, they actually had a little bit more longer trials, and they found that the optimal time for the AstraZeneca trial was actually 3 months. And that's the recommendation. If you look at the AstraZeneca website, they recommend 3 months right off the bat. And so they started to do more and more studies on how to roll out Pfizer and Moderna. And Israel had access to a lot more vaccine faster than everybody else. And they've managed to get their first doses, or I think about 85% of the country has first doses done, and close to 50% of their population has their second doses done. And so they've provided us with a lot of population data that we can use to inform our decisions. And we have now learned that if you have to go anywhere between 2 to 6 months, you've got a better immune response. You get better T and B cells there to provide you with that long-term protection. And this can be actually seen with other vaccines. When you look at people that are getting vaccines for shingles or for hepatitis, we always give a 2 to 6 month period between when you can give the second dose to get that proper longer term protection. With our hepatitis shots, once you get your second shot, and with the shingle shot, you get the second shot, you're covered for at least 10 to 15 years. And that's what we don't know about these vaccines. We know that we're going to have protection for at least a year because we've got the data to prove that. But we're going to continue to test and see how long the protection lasts. And it may be that we end up getting, that's it, we get the 2 shots and we've got good protection for the next 5 to 10 years. We don't know yet, and that research will need to be done. There's some studies already going on that maybe we'll need to do a booster shot next year, similar to our flu shots. But again, we don't know until that research comes back and we can give a clear, informed decision to everybody. I don't want to make any comments, but that's where that 4-month window came in. It's just looking at the real world data done, collected on patients that have received the vaccines. And we noticed that their antibodies were still quite high at 4 months. And so it was safe to give people that time. And we've seen this also when people actually get a natural infection, you get an antibody boost. And then after about 2 to 3 months, that with a natural infection, it actually starts to go down quicker. With a vaccine, the first dose actually allows the antibody levels to stay much, much higher for a longer time period.
That's very helpful. Thank you, Dr. Sanghera, for the detailed question. I know we have so many questions, and then I also see some questions in the chat, but just to let everybody know that we actually already received tons of questions through the registration of this event. So we're going to try to go through that as much as we could. So I'm going to actually ask you 2 questions at the same time, if you don't mind, to save time. The other 2 questions that I have from our local constituent is that the first one is, are vaccines less effective against the variants of concern? And also, what are the chances of spreading the virus after you get the vaccine? So if you don't mind answering those 2 questions together. Thank you.
Sure. I'm going to answer the questions back to front, right? So the vaccines have shown that there's a 90% reduction in transmission. So if you do, and there's a 95% reduction in serious illness. So that indicates there's a 5 to 10% chance that you can still get infected by the virus. But you will not have serious illness. You will have maybe more of a mild cold-like symptoms, but then you're still carrying that and you can spread it to other people. But there's a 90% reduction after 2 doses of vaccine. It's still far better for all of us as a population to get as many people vaccinated as possible so that we can reduce that transmission. And also reduce the risk to our more vulnerable people in society, like our seniors or people with multiple other disease conditions. With regards to the effectiveness against variants, all of the vaccines show a reasonably good response to the variants of concern and also to the variants of interest. The ongoing studies are always there. We're always collecting more data. We're always finding out as each week or 2 weeks goes by, we see more data coming. I'm getting more and more confident that we're going to be okay. Now, the only issues that I have is if we start to see places like India or Brazil where or even the US, where we are seeing spread happening so widely and it's happening without any kind of protection, the risk of other variants being produced as each time a person gets infected, the virus can mutate and learn a little bit more from us. It can learn how our bodies work, how our immune systems work, and it can try to evade the antibodies there. So there's a risk that if we don't help everybody get protected, there's a risk that these variants may become stronger and sneakier and continue to evade our defenses. And we need to stay one step ahead of them.
Thank you, Dr. Sanghera. I'm going to be asking a couple of questions from constituents as well. And actually, the first one is directed to my colleagues. It's about the whole process of registering. So I'm just going to read out the question. I received 1 dose of the Pfizer vaccine, and I was advised to wait for notification for the 2nd dose. On the CBC News, they reported that Dr. Bonnie Henry advised that everyone should register. To avoid confusion, what should I do? Wait or register? And I think our colleague Anne is going to answer that question.
Great. Thank you, Janet. So you only need to register once. If you have already received your first dose at a pharmacy, or if you received your first dose before the online registration system was set up, you should still register now. So it is possible you may get a notification to book another first dose appointment. But if you've already had that first dose, you can just ignore that notification. You will get another notification when it's your turn for your 2nd dose. I was wondering if Dr. Sanghera would like to add any details I may have missed.
No, you hit everything right there. We changed our provincial booking system on April 6th. And so if anybody received any kind of vaccine prior to that, or and you didn't book in the provincial system, I would urge you all, whether you've not had a vaccine, had 1 dose, or even 2 doses, I would still recommend that you register in order to, getting an echo, sorry. In order to be in the system so that we don't miss you when you need a booster.
Thank you. Oh, I'm getting an echo too. So my next question is to Dr. Sanghera and to Anne, but Dr. Sanghera, I'd ask you to answer it first from your perspective. Are all the COVID vaccines safe for women intending to have children in the next few years?
Excellent question. That's actually been coming up quite a bit. So there's some rumors out there that the vaccines cause infertility, and they're absolutely untrue. And also that they may cause some problems during the pregnancy. I actually showed you data earlier and showed you that when a woman is pregnant, her risk of getting blood clots and risk of miscarriage due to those blood clots is 1 in 300. Right, that's quite a high risk, and it's such a high risk that NACI and Health Canada and our provincial government has actually approved pregnant women for a vaccine on a priority basis. So we're actually moving forward with it. It's safe in pregnancy, and we want women to actually get registered, and then if you register online, then pick up the phone after you've completed your registration to let them know that you're pregnant, and you will get a priority booking, and go ahead and do that. It's extremely safe. We want to protect both the mom and the baby, and this is the only way that we get a 2-for-1. Talk about efficiency in the system. You give 1 jab and you protect 2 people. We're seeing women that have been vaccinated during pregnancy, that their babies are being born protected with antibodies in their blood. And so it's definitely worthwhile getting that done. But getting back to the question about women that are of childbearing age, these vaccines do not impact fertility at all. Every single gynecology and obstetrical specialty group around the world has signed off on a report saying that that is true.
Thank you, Doctor. I think there's a lot of people on the town hall who'll be very reassured by that. And Anne, I think you were going to add a few points as well. Or not.
Here I go. Okay. Sorry, it's technology. It's technology. Just like Dr. Sanghera has said, all pregnant people, women who are age of 16 or over are now eligible to receive the COVID-19 vaccine as a priority population through BC's immunization plan. And as Dr. Sanghera has said, Dr. Henry has said that all Health Canada approved vaccines are safe and effective. And so therefore, Dr. Henry encourages everyone to register and receive the vaccines as soon as possible as they are eligible. And also this includes people who are pregnant. Dr. Henry and her team have also reviewed the data here in BC and shows that pregnant people experience severe illness from COVID-19 at a rate that is similar to people who are in their 50s. So by prioritizing pregnant people today, we add another layer of protection for them and their babies and their community. So not only is it 2 for 1, I think it's a 3 for 1. So thank you for that answer, Dr. Sanghera.
Welcome.
Well, thank you, Janet and Anne, and especially Dr. Sanghera for such a detailed answer to every question. I have a next question for Katrina. Maybe you can answer that. Are the Burnaby teachers now considered to be in high-risk communities enough to be prioritized for the vaccine like teachers in Coquitlam and Vancouver are? And also, what other groups like firefighters and police are they now be part of that prioritized communities?
Thank you so much, Raj. I think it's important to actually take this opportunity to thank all the frontline workers, including teachers, K-12 workers, childcare, firefighters, RCMP officers, and all the ones who have been waiting patiently, who has been going through this very challenging time on the front lines and doing a very important work to keep our community safe. And Burnaby has really done an amazing job. I have to say, thanks to our frontline workers who has really followed health and safety protocols, and we're doing pretty well relatively comparing to other communities. So thank you so much for that. The good news is starting today, today, Fraser Health has invited all the licensed childcare workers, teachers, school-based staff, police and RCMP, and also fire departments in our region who have not yet received their COVID-19 vaccine to book their immunization. Fraser Health will complete the immunization of all these priority groups actually over the next 10 days. And as supply improves, because as we know that this is really, a lot of our vaccine rollout is really based on the supplies that we have available. Public health, if there's enough supplies, will expand the number of frontline workers who can get vaccinated. And I also really want to give a shout out to a lot of our frontline workers and organizations. I see our firefighters president, Jeff Clark, who is also joining us for this call and who has done such a great job communicating and really reassuring your members and the firefighters to make sure that we wait patiently during this process. So thank you so much for that communication so we can better address the concerns and also make sure as we wait for more vaccines to come that everybody's going to get vaccinated. So workers that are in those category will be contacted through their employers with instructions about how to book their appointments. And again, we really appreciate the cooperation that has been done locally and the work that our frontline workers have done. And the good news is not just the frontline workers, everyone in BC is expected to receive their first dose by the end of June. And that really just, gives us the hope and the light at the end of the tunnel. And we really need everyone over the age of 18 to register today. So thank you so much for the question.
Thank you, Katrina. And I have another question from our constituent for Dr. Sanghera. It reads, my parents recently recovered from COVID. How long after they recover should they wait to receive the vaccine? Which vaccine is better for those who have already recovered from COVID?
So when somebody gets an infection from COVID, their immune system produces antibodies in their system. Those antibodies will stay there for at least 2 to 3 months, and then it starts to decline after that. So you have a safety window anywhere from 1 month to 3 months in which to receive a vaccine. I would urge people not to just recover from the infection and rush out to get the vaccine, because your immune system is then going to get all riled up again. And so you just recovered, give yourself a little bit of a break, maybe wait about a month. And then anywhere from 1 month to 3 months, that window you can book yourself in, get a vaccine. And all of our vaccines that are offered are equally effective, equally safe, and equally impactful. I have no hesitation recommending all 3 of them, as long as you don't have an allergy to the polyethylene glycol or a risk for blood clots. And it's not just the leg blood clots, it's specifically these brain blood clots. And if you have low platelets, let's go with the mRNA vaccines. Otherwise, you can pick any one, the first one that's offered to you. We have a saying in medicine that the best vaccine is the one that goes into your arm.
Thank you, doctors. I think those were the questions that we have had received from our constituents. And thank you so much for everyone for, sending us those questions in advance. It's wonderful that we have had a doctor like Dr. Sanghera available to answer those questions. We really appreciate on behalf of all our constituents, Dr. Sanghera, for your service to the community. And we also, as my colleagues have said, want to thank all the frontline workers for their patience, for their hard work to make sure that our citizens are taken care of. Again, I would like to urge everybody that now everyone 18 and over to register for their vaccine as of today and book their appointment as soon as possible. You can also register, maybe Letitia, you can put that website link on the screen again. Anytime at www.gov.bc.ca/getvaccinated. Or you can, and all that information on that website is available in various different languages. It's very easy to follow. Or you can call 1-833-838-2323, 7 a.m. to 7 p.m. daily, and then you can get information, you can get registered. So again, I would like to say thank you to Dr. Bonnie Henry and her team, Health Minister, Mr. Dix, for all their efforts to keep BC safe and healthy, and all of you participating in today's town hall. And please be safe. Make sure you get vaccinated as soon as possible and follow all the instructions provided by our healthcare providers. Thank you so much and good evening.
Bye-bye.
Thank you, everyone. Have a good night.